Well, mental health is similar to physical health, I think, in that it's something that students need to be successful, that they need to be able to learn, and whether they're able to learn because they receive the support they need academically, or physically by being well fed, or mentally by being able to focus on what's happening in school and not dealing with emotional issues that get in the way.
Being in a safe and nurturing environment as a child gives someone the resilience to deal with the stresses of daily life, and I guess I would say that that is mental health, is having that kind of resilience.
Well, personally, my family, there has been a history of suicide, and I just feel that it's important that we talk about it, because in my family it was kept a secret for so many years.
I'm a mom. I have 2 kids. I had an amazing niece that took her life in October, this last October on the 23rd, totally unexpected. She was smart. She had just gotten Student of the Month. She loved to draw. She loved to draw horses. She drew just anything, and she just had a great heart.
I think that it's an area, mental health is an area that sometimes we're reluctant to talk about because we're not sure how students or parents will react if we bring up issues about student mental health, but I think we need to get over that and make sure that it is something that we keep in the forefront of our awareness, and we learn what to look for in case students are struggling so that we can help them.
I think I've had my head in the sand a little bit, and I think that's probably how the general public has too. And then it kind of gets a stigma with it. It's really important for us to get the word out that anybody's kid is at risk.
I think the Mullins Healthy Children's Fund is important because it supports many different efforts in our community to help families raise children in healthy ways, to improve the mental health and emotional resilience of people in our community.
I think we play an important role to decrease the prejudice that we have in regards to mental health.
We've been focusing a lot of our efforts on information and educational campaigns. Some of it's being done through direct education and training with our mental health first aid programs. Other tools we're using are more of a marketing or communications type of approach through billboards, through stories, and other activities. And I think in large part to reach out to people and just let everybody know it's okay to talk about this. This is something that most families have dealt with or will deal with in the future, and it's a much more comforting position for them to be in, to know that others have had those experiences, that they've got resources available to them. It's especially important with our kids in their formative years to make sure that the school systems, that the parents and other groups that would be interacting with them are aware of the signs and symptoms to look for a child that may be troubled, and also for the signs and symptoms of how to work with the families to help address those issues.
This is our family that this fund represents, and so therefore we want to make sure that we can do as much as we can, for our communities. And that's not only in Benton County, but in Lynn County and Lincoln County.
One of the things that was really wonderful about the support that they gave for the program that we did this year is that it became extremely popular. We had a standing room only crowd, which was amazing. And people were so excited about the information that they heard and so happy with what they learned from that experience.
You know, I think that these kinds of foundations and charitable organizations are great partners for us, both to point out to us some areas of training that we may not have participated in before, as well as support us financially to be able to send a good number of our staff to get the kind of training that they need. I think it's especially important for our regular classroom teachers, our educational assistants, to have that training so that they can be first responders when they spot something in a child that they're concerned about, and then know where to go or where to refer students to get the help that they need.
We would always like to be able to reach more families. We would always like to be able to make it easier for families to access the services.
Lily could have been anybody's daughter. You know, Lily could have been anybody's niece. And so I think her story is important to tell because there's so many Lilies out there. If someone stops breathing,
or a loved one is choking,
Many of us know what to do.
but if someone expresses suicidal thoughts,
The solution and its effectiveness is much more complex.
mental illness is a legitimate and often unrecognized medical condition.
your support for the Mullins Healthy Children's Fund helps train
Counselors, teachers, medical professionals, and first responders.
To listen, identify, understand, and respond to signs of mental illness.
Your support can prevent a senseless tragedy.
your support can help save lives.
You can make a difference.